seniors psychiatrist there, and sir also have some RCT experience people. So all of them are there. So I think it is a mixed group of beginners, and some of them also have experience. So let us start this, and don't think that I am teaching or giving a lecture to you. So whenever you have a doubt, put question, raise your hands. Then I'm not able to see your face. It is that online base. I'm able to see only my screen. So you can raise your hands. You can stop me in between also. So with this today, what we plan to discuss is introduction to systematic review and meta-analysis. Then we'll be discuss key concept and importance in evidence-based research. Then we'll be touch a little bit about the developing a strong protocol, how to develop a systematic review protocol. Then subsequently we follow with some hands-on practice that will be designed. So with this, start with some of the basic things which you are involved in our day-to-day life or in our career. Those who are doing master thesis, those who are doing thesis, or those who are doing PhD, or those who are also doing any part of any project. So what you think, what is the difference between literature review and systematic review? So I think many of you heard about the term literature review. So do you think is there any difference between the literature review and systematic review? So what do you think? Anyone can unmute yourself, and you can also discuss. So what do you think in your view? What is the difference between literature review and systematic review? Because everyone is doing systematic review in their career. Part of master thesis, part of PhD thesis, part of any project when you are doing, definitely you are doing a literature review. So what is the difference between literature and review and systematic review? So anyone?
Um,
Dr. Yes, sir. Please, sir.
so in my opinion, we in systematic review try to build a base on which we can review the all the articles or studies so that we can compare them to at least some extent.
Sir, in literature review?
In the systematic review, in literature review,
Sir,
sir,
Yes, sir. Mahesh, sir, please. Then
yeah.
we'll
So
go
in
to the others.
literature review, the base may not be the same, but in systematic review, we try to get the base same as the study settings, the study type, and the area in which they are studied, etc.
Yes, thank you, sir. So
uh,
anyone else?
sir, systematic review is a part of literature review, and systematic review is a unbiased one.
Okay, so good, good. So who is saying this?
Dr. Deepa,
Ananya?
Dr. Deep.
Deepa, Dr. Deepa. Very good, very good. Yeah, so good. So, good point. So, let us discuss some point what you already mentioned. So, the table where I have provided literature review versus systematic review, because that is very important to understand. So, in literature review, it's a general overview and narrative review. The purpose of systematic review is we conduct a general overview of the topic or subject and narrative review. But systematic review is comprehensive and unbiased evidence synthesis. Let us, for example, see if I say what is the mm, uh, burden of depression among adolescent in India. If what is the burden or what is the prevalence of depression among adolescent in India. So when I do a literature review, simple, I'll go to the Google Scholar, then I will be type the word depression adolescent in India. So I will find 3, 4 studies, or if I have the global burden of disease studies, or any systematic review already conducted, or any else. So I will just take that information, I'll write. So if I when I am doing this work, if I miss out some article also, it doesn't matter. So it's a not systematic way we did it. It's not a comprehensive search. So then 5, 6, 7, 8 article will say, then we can say that, okay, these are the depression among, these are the studies presenting the depression among adolescent in India. But if same things, if I want to do a systematic review, I have to sure ensure that we cannot miss any study. So because we will have to develop a comprehensive search strategy, maybe the word the condition depression may be used in other way. So we have to capture all the related studies among adolescent in India related to depression. So then we have to quality assess or critically appraise all the studies. So then we have to follow standard protocols like search strategy, inclusion, exclusion criteria. So everything we have to systematically extract the data. Then we are presenting that evidence. So that is the difference. So where in literature review we are providing a just narrative review, here we are providing an unbiased evidence synthesis. So that's so because the literature review, the methodology is very informal and subjective also. So where someone could search only one database, someone could only Google also, so that presentation, nothing will matter. But when you do systematic review, the methodology should be very formal, structured, and transparent. So what is formal, structure, transparent? We can detail discuss in between the course. Then second is that when you are doing a literature review, your question is very broad and is a general topic. But systematic review should be very specific and more narrow question because you want to say depression among adolescent in India. Then the study must be related to depression among adolescent means which particular age group and in India. How many studies are there? You have to systematically identify, screen, then finally you have to include the study. Then you see what is the prevalence in the different study they presented. Then you can do a pooled prevalence or meta-analysis. See there, okay, this is the overall. But when you do a literature review, you don't need to put pooled prevalence. You have to say, okay, the prevalence in different study wise. So because the research question is very broad. That's why the data analysis in systematic review, you have to do quantitative meta-analysis or qualitative descriptive. But in literature review, just we are providing a descriptive and qualitative findings. Qualitative in the sense just description we are providing. In literature review, therefore, the evidence is very low and it is very useful for the background information when we are writing a background of the study. However, the systematic review, since we are doing a comprehensive search strategy with a structured approach, which is a formal approach, with very specific research question, the evidence generated is very high quality, and that will be very useful. Or the mostly the outcome is evidence-based conclusions. By doing a literature review, I cannot say that the overall prevalence of depression among adolescent in India this percentage. But by doing a systematic review, I can say that overall prevalence of depression among adolescent in India is this many percentage. So that is the difference between literature review and systematic review. Because here, how many database you have to include, what are the key search strategy, what are the PICO, population intervention comparison you have to follow. So you have to follow the all procedure, how you extract the data, even if when you get the article also, how you critically appraise, check the quality of the studies also. So that is very essential. So therefore, systematic review are more rigorous, focused, and reliable compared to literature review. which making them ideal for evidence-based decision making. So therefore, we are doing systematic review. Now let us see. So now let us see this picture. So can you somebody explain what you see in this picture? This figure, what this figure is telling about this? Anyone? Quickly. Yes, please. What you see in this picture? Have you seen anything in this picture? Melinda, is it visible?
Yes, sir, it is visible.
So you can pick up one name randomly. So they have to read also. Then I can get some answer.
Of course. Dr. Deepa Mandal.
Dr. Deepa, what do you see in this picture? I request all of
Sir,
you, please participate in the discussion. I don't want you to sleep. So if nothing is wrong and right, I'm just asking your perceptions. I'm not getting judgmental to make you interactive in these sessions. Okay. So what
I
do you see?
think, sir, in this picture, how to write a systematic review in different uh, topic or cohort studies. I don't know exactly.
Okay, so you are thinking that. Okay, very good. So anyone else? What do you think? I'm just asking your perceptions. So Dr. Archana, what do you see in this picture?
Hello, sir.
Yes, please.
Yeah, sir. Actually, I'm new for this thing, but I can say a little bit
Right.
kind of quality of the evidence is increasing. Actually, if you are going through the systemic review, so like I don't know exactly, but
Very
whatever
good,
the
very good point.
criteria,
Very good point.
yeah,
Quality of
but
evidence is increasing in the systematic
yeah,
review.
like
Then
we can
any
differentiate between unfiltered and filter. Like suppose we are going through a particular paper, so we can read out, we can extract the unfiltered information like that, like quality kind of thing also maybe.
yes, very good. So let us see that. Is a
Yes,
no.
sir.
Why we are doing research? Because research we are doing generating some kind of evidence for policy implication for the policy and practice. So that we are doing research to generate the evidence, which will be very useful for the change the policy or practice could be clinical practice or practice could be the community level practice also behavioral change intervention. So that's why. So by for doing the in research, so we are doing various type of study approach like just expert opinion or background information also we can generate some knowledge. Then we can do some case control studies, case series or report or cohort study, or we could do some randomized control trial also. So this is the independent study we are doing, and this study also giving some informations also or giving some evidence. This is very essential. But once you go ahead, if you want to improve the quality of evidence, the filter information is very important. So the critically appraised individual articles or critically appraised topics like evidence synthesis, and tough is the systematic review. So what is this? This is a pyramids which the baseline is low quality evidence and the top line is the high quality evidence. And here there are two type of informations. Unfiltered information, when you do any background studies or expert opinion, it is very least reliable evidence. But when you do case control, case series, reports, it's observational study offering moderate evidence. Cohort study, prospective observational studies with improved reliability. So the reliability of the finding, when you do RCT, randomized control trial, it's an experimental study providing very high quality. However, it's an unfiltered evidence. Means if one RCT give, okay, the intervention is effective, maybe we can get other RCT, the intervention is not effective. or we can get if the effect intervention is very highly effective, somewhere we can say moderate effective. So these are the individual studies result. But when you say that filtered informations, that means critically appraised individual article summarize very high quality studies, because we are grading the studies and we take it the only high level. Critically appraised topic evidence synthesis from multiple studies on a specific topic. And systematic review, it's a very comprehensive review of all studies, often including meta-analysis. So it's very high quality evidence. Let us see that if I ask what is the differentiation among adolescent in India, then what you will do if you do you found a prevalence study, or then you can say, okay, this is the percentage as per the study. Yes, the answer is correct. Maybe some studies conducted in Hyderabad say 20%, some studies conducted in Odisha, Bhubaneswar, say 10%. Some studies in conducted in that other setting, it's say 80%. And you have to choose study conducted in community or study conducted in hospital-based population is different. If I take the population for only hospital adolescent, that maybe we can get high prevalence, but that is not a correct sample tell the true prevalence, because they all are they have some sort of psychiatric condition they came. If same study I will do in the community, I will be get different result. But when you do a systematic review, so you collected all the studies conducted, then you check the quality of the study, then you synthesize the evidence and present it. That's why it's very filtered and high quality evidence. So this is all evidence based pyramid. So we are generating the evidence. So that's why systematic review is giving the comprehensive review of all studies conducted in a specific topic or specific area in a specific setting. So that's why the information is very high quality. So what is then evidence synthesis? So evidence synthesis is the process of systematically gathering, evaluating, and integrating information from multiple studies or source to produce a comprehensive and reliably understanding of a specific research question or topic. So you have a specific research question or topic. What is the prevalence of anemia in India? So what you will do if you want to synthesize the evidence, so you will be say, okay, I can get answer from the NFHS. National Family Health Survey will provide that. Or if National Family Health Survey, the anemia is not there, then you will be see what are the government database, like routine data we are collecting, like HMIC, Health Management Information System, if they are providing. But if I want to do search, if I do a quick literature search, I found 4-5 studies in different contexts. Some were conducted in Hyderabad, some were in the Delhi, somewhere in this, then they presented that. Then I will be do simple. So if I want to systematically gather and evaluate and integrate all the information, all the studies conducted in India related to prevalence of anemia, then I will be do a systematic procedure. That means, so first you summarizing all the data, then analyzing the data, then combine the data, then you could have a, finally it will be very useful, the policy making or evidence mapping or improve your understanding of the topic. It could be a very broad idea. So that is the evidence synthesis. So when you do evidence synthesis, so when you do evidence synthesis, so there are many type of evidence synthesis. I don't want to explain in detail. Everybody came across the terminology. You heard about systematic review and meta-analysis. Sometimes you heard about narrative review. Sometimes you heard about mapping review. And sometimes you heard about overview of review or umbrella review. Sometimes you say realistic review, scoping review. So these are the various evidence synthesis mechanism or process. But all the way we are doing systematic review, systematically reviewing the evidence, but some stage the procedure is very straightforward. Some cases the procedure is very not strict forward. Means I can say that these slides, see, if you I will be try to compare between three things. If I do a systematic review, meta-analysis, or scoping review, they are rapid review. Then what we say, does this all type of review or evidence synthesis things need a prior protocol? Yes. But when you do rapid review, you don't need a prior protocol. But when you do systematic review, meta-analysis, or scoping review, then yes, definitely you need a prior protocol. Prior protocol in the sense how you want to conduct the study, what is your inclusion criteria, what is the exclusion criteria, what is your search strategy, what context you want to study, what are the conditions you want to study, what could be the possible outcome of the study, what is the possible outcome measurement of the studies, how you want to the measurement, what type of study you want to include in your review. It is only the observational study, or it is the only experimental study, or it is qualitative study, or it is mixed method study. So that you have to clearly define in that protocol. So we'll be detailed discuss about the how to develop a protocol. Then question is that where to do register of that protocol. So today we'll be discuss, you can do Prospero, JBI, OSF. So these are their research. But if you go to the Prospero only take registration for systematic review and meta-analysis. Prospero will not take scoping review. Yes, then coming to the comprehensive search. Yes, everywhere we need comprehensive search. However, in case of rapid review, there is no need of the means comprehensive search, because it's a rapid review. Then screening, duplicate screening and data extraction, yes, needed. Critical appraisal, yes. Critical appraisal means in the quality check, or we can say risk bias assessment if it is a RCT or observational study. So then we can say that yes, if you are doing a systematic review and meta-analysis, you need a critical appraisal of each included study. That means critically appraise the quality of evidence, high, low, or moderate quality of evidence. If you if you can also remove the studies which have low quality evidence, or you can remove the studies, don't include the studies which have low quality evidence in the meta-analysis, that things. So yes, scoping review may not need any statistical analysis. However, systematic review and meta-analysis need a statistical analysis. Usually the time period say one year plus, but now with your experience we are saying that if you have a very rigorous team, continuously you can work. So even if within 6 months you can generate a systematic review, 3 to 4 months or 6 months you can generate it, depend on how many studies you get identified, what are so. So these are the basic difference between the various type of studies. Similarly, a realistic review, overview of review, support some area there are many systematic review. So no need to do another systematic review area. Then you can do umbrella review, means overview review. All systematic review presented in there, you can do also. You can do mapping review, narrative review, realistic review, some policy related review. So these are the basic difference between different type of evidence synthesis. I think many of you heard about this, but often we have a question, what is literature review, what is systematic review, what is a scoping review, what is a mapping review. Sometimes you go, your supervisor will say that, okay, do a scoping review on that area. Really, we don't know how the scoping review is different from the systematic review. Yeah, it is good to do a mapping review. So what is mapping review essentially? So when I do a mapping review, really do I need a comprehensive search strategy? Do I need a critical appraisal tool? Do I need any type of statistical analysis? So these are the questions. It's very important. So when I do a mapping review, is it necessary to register? Yes. If yes, where I have to register? Can I register it in Prospero? The answer says no. Mapping review. Prospero cannot register narrative or mapping review. You cannot do registers. Here, narrative review basically they says that is literature review. Okay, it's a literature review, what we call. This is narrative review, where there is no need of a protocol, where the protocol registration is not required. Comprehensive search strategy is also not required. Varied duplicate screening is not required. Critical appraisal is not required. You can do within the less than 6 months. You can do or 3 months. So what you are usually do when you do conduct your thesis, you are doing a review because you are just searching what are the evidence in that area and what is the gap. Then based on the gap, you are doing your thesis or project work. So this is the basic difference between that evidence, various type of evidence synthesis. Now let us discuss finally what is a systematic review. According to the Cochrane, a systematic review is defined as an attempt to identify, appraise, and synthesize all the empirical evidence. So we have to systematically identify, then appraise, critically appraise, check the quality and synthesize the data, extract the data and synthesize data, all the existing empirical evidence that meets pre-specified eligibility criteria. That means we must have some inclusion, exclusion criteria, and what is the population, what could be. So that will clearly criteria we should mention to answer a given research question. So we have a research question, we have the inclusion exclusion criteria, we have the specified population, specific setting, then we'll be searched accordingly based on our PICO strategy. Then we systematically identify, taking 3-4 database, critically appraise and synthesize, means we have to extract the data, then we'll be analyze the data and present the data. So finally, what is a systematic review? It is a attempt to identify, appraise and synthesize all the empirical evidence that meet pre-specified eligibility criteria to answer a given research question. So researcher conducted systematic review use explicit methods. What we explain, explicit method, which aim, why we are using explicit method, but it will be minimizing the bias. So when you minimize the bias, then you will be generate more reliable evidence, which will be more useful for the policy informed decision making or policy. So that's why a systematic review is not same as a narrative review or literature review. So unlike other kind of review, systematic review must be thorough and unbiased as much as possible, and must also make explicit how the search was conducted. We have to define clearly how the search was conducted. So even someone want to replicate that, they can replicate the study. They can replicate the study by taking same search strategy, everything. So this is the definition of systematic review. So then what is the purpose of the systematic review, which we already discussed? The purpose of systematic review is to enhance the understanding and guide research priorities. That means it identifies trends, pattern, and knowledge gaps. So when you systematically do any topic search, then you find out what the existing knowledge, what are the understanding about that particular topic. Then you really identify the gap, which could be guide for the further research in that area. Identify trends, pattern, and knowledge gap. It highlights the area needed for further investigations. Second one is it support informed based policy and practice. Whenever we are developing a clinical guideline, then the systematic review is very important. Then we are saying what is the effectiveness of particular drug or particular therapeutics. Then we do a systematic review of all the randomized control trial or clinical trial conducted in that area. Then we are systematically presented. The outcome could be effectiveness in terms of recurrence, in terms of success rate, in terms of duration of hospital stay, in terms of quality improvement. So these are the outcome in a randomized control trial, and safety. What is the safety of this also? Then we search all the studies related to of the particular intervention or surgical procedure or therapeutics. Then we present that information doing the meta-analysis. Then we can say the intervention is favored towards the intervention group or the control group. Then we say that either we can suggest this to include in the policy or not. You could include that clinical. Again, another thing also, when you are doing, not only will be just take randomly the RCT, after searching that, we can also see quality of that evidence also. We have to use the grade also to grade the evidence also. What is the quality? Even low quality evidence, if the study design is not robust or something, that will be discussed in one class detail. So we can exclude from the studies also. So then that information is very useful for making clinical guidelines, for clinical practice or clinical decision, that which is usually not happening. That's why you know that if you see that research, then policy, then practice, there is a huge gap between research, policy, and practice. We are doing many research, many generating many clinical studies every day. We are doing in globally lot of clinical trials, clinical studies we are doing, but how much is reflected in the policy? How much are reflected in practice? Very few things are reflected in policy and practice. So if you want to make it policy, you systematically source the evidence, provide the pool effectiveness, thus evidence, then that becomes policy. Then you that should be again practiced by the clinician, practiced by the program people, then practiced by the community, then it will be really implemented. So that is true. So then you can take the research to policy to practice. So this systematic review also very much helpful for generate the evidence which you could make change the policy and practice. So where you could use, what are the field? It could be used in the any healthcare settings, it could be used in the educations, it could be used in the environmental science or climate research, it could be used in the social policy also. So these are the broad area you can use. So that means when you are doing a methodology, learning a systematic review and methodology, don't say that you are whatever field, wherever you are field, you can do a systematic review in your domain, in your area, and then you published it. Then because you are providing a good, so that's why when you publish a systematic review, you can cite the paper, could be very well cited. I will give some example of my Google Scholar things. You know that some paper are published long back, it was not 2-3 citation, but some recently published 2023-24 got more 12, 30, 40 citation also. Because systematic review people usually use in the literature review, because when you are do literature review, you can include the systematic review, then that means you can much of the information you got. Okay. So this is the purpose of systematic review. Then what are the various steps? Yes, in the during this the process we can learn all the key steps, but I'm very quickly just explaining the steps. First, most important point is the team. So I unfortunately many of time people thought that yes, I can do a learn systematic review. That is not recommended. It's a teamwork. Transparency is needed. Transparency only come when a team is there, because often we know that often our what I'm doing, I cannot guarantee that all the time. If I am a talented person also, I cannot guarantee that I can give always the quality work, because it depends of my current mind state. So if that thing is done by two people simultaneously and reviewed, cross-checked by the third person, then definitely will be get good quality. For example, I'm giving 100 article to screen. What are the article include depression among adolescent X, and same 100 article to Y. Then Y included 10 article, X included 5 article. Then there is a conflict between X and Y findings. Then I say why there is a conflict. Then third person will be review. Okay, no, this study should be included. This study should be excluded. So if one person will be do, it is not possible. But unfortunately, many of the medical colleges, they expected one person do systematic review in the dental field. It is unfortunate. So, so it's a teamwork. It's a teamwork. So to at least minimum 2 to 3%, minimum 3% is needed, and someone should be subject expert. If I am doing a systematic review on mental health, Maybe I may not have methodological skill. I may not have some specific terminology which is related to methodology. If I am doing a systematic review on RCT, randomized control trial, I may not have understanding on each term. So in that case, the subject or methodological expert involvement is very necessary. So it's a teamwork. So we'll be discuss also why teamwork is essential. Then develop a research question, very precise research question. So I think next class tomorrow, maybe tomorrow, will be say that how to use formulate a question. What is the PICO criteria? What is the spider criteria? What is the concept mapping to do a formulate a research question. Then set inclusion and exclusion criteria. If I am interested to only depression among adolescents in the India, I should not include the studies which is conducted in other than India. I have to include all the study only in India. If I study the depression among adolescent LMIC, then I have to find out, okay, these are the LMIC country. Then the LMIC country should be conducted. If I found some study in the USA, I cannot include that. If I want to study the only depression, then I have to, what is the definition of depression? What are the study to be included in the depression? Proper definition. Then what is the adolescent? So what is the definition of adolescent? If some study cover both adolescent and adult, can I take that? Yes, if I include the study, I will be only take the information related to adolescent if the study is presented separately for adolescent. If the study is not presented separately adolescent, all the population included, then I cannot take that because that study will be not fulfill my purpose. So that's why inclusion and exclusion criteria is very important. And you plan a protocol, systematic protocol. Then you develop a search strategy, specific search strategy. For example, let us say that why is search strategy is very important. You know that if you know that in some terminology, there are multiple synonyms used for the single terminology. Many author use many type of terminology also. So we want to capture all the articles. So for example, let us anyone can help me. So Melinda, what's your good name? Melinda Misra. Yes, Melinda.
Yes, sir.
So what is your nickname or pet name? What in your home they are calling?
They call me Bubbly.
Bubbly. And what in the other friends or your mama house in other they calling any other name? Sometimes.
No, Bubbly is the most name. But my
Okay.
friends call me
Okay.
Millie.
Millie or Melinda. So my objective is that what are the records? What are the info? I want to collect all the information about Melinda. If I go ask what about Melinda, then I will be get all the information only related to Melinda. But the Melinda is the same person, Bubbly is the same person, Millie is the same person. So I have to search information. When I search information, I say what is the information related to Melinda? What is the information related to Bubbly? What is the information related to Millie also? So if these names are different, so then I will get comprehensive result. If I only search the records or information related to Melinda, but as part of the Bubbly, whatever the activities information I may lose. So similarly in systematic review, if I want to suppose I say I want to search a particular let us any conditions like I can say hemoglobin. So if you want to study anemia, so you can use anemia. Even anemia, what are the spelling they are using? Hemoglobin. So what all the related synonyms use, even use the mesh term also that will be detailed. So comprehensive search strategy is very important. And databases. Databases in the sense Google Scholar is for your kind information, Google Scholar is not a database. Google Scholar is a search engine, but the database like PubMed, that is called Medline. Then you have database called Embase. You have database called the PsycInfo, where psychiatric related research will be get. You have database called CINAHL or ESPCO, where nursing related studies you will be get. We have database called Web of Science. You can get all sort of studies in that. Database called Scopus. Database called the then you have specific database like in engineering related IEEE, So there are many database. At least 4 database you must include. PubMed is free. Then you have to search another 3 database. Again, one must be your topic specific database. If I'm doing any study in the psychiatric area, if I miss the psych info, then I may very little chance of lose the study. So how many database, what database you need, that must be strict. Then you have to document all the things. Then you manage the search result. Then screen for the publication. Then not only stop at the screen, then you appraise quality, critically appraise all the study, assess the risks and bias of all the studies. Then you include, okay, these are the study included. Then you extract the data, analyze the data, synthesize the data, then finally write and publish the result. Okay, these are the key steps to conduct the systematic review. I hope will be cover all these steps during your journey in this course. So then let us see that I use the word called meta-analysis many times. Let us discuss with that example. Now we very much clear about systematic review. We can take 1-2 questions, Abhinav. Melinda, we can take some questions if anyone have any doubt or any specific
Of course, sir,
questions.
we can. If
Yeah.
anyone
Yes.
has any questions,
Sir,
Yes, please.
sir, can this systematic review be qualitative or quantitative or some kind of mixed?
Yes, sir. Very good question. It could be systematic review, could be qualitative. You can include only qualitative systematic review. I'll give you some examples some days we have published. You can include both qualitative and quantitative studies, including mixed method also. You can do only systematic review and meta-analysis. What happens when you're doing a systematic review, if you have enough quantitative data in a homogeneous manner, then we'll be do meta-analysis. Otherwise, all systematic review, you cannot do meta-analysis. If when I do a systematic review of randomized control trial, then I may need meta-analysis because there I can quantify the information. I can do a forest plot. I can do a funnel plot. So yes, when I do a systematic review of only qualitative study, it's a systematic review. I have a systematic review of qualitative studies. Then it was also 37 citations. I can show you in the end of the session in Google Scholar. Yes, you can do only qualitative systematic review of qualitative studies. If you say what is the barriers and challenges for the uptake of for the IFA consumptions, then you may not get a good if you use only quantitative studies, then you may include may lose some information. Barrier and challenge, mostly qualitative study presented, and then you can do systematic review of only qualitative studies. That is possible. If you want to both mixed method and qualitative studies, you can include also. So you do what are the quantitative result in that article, what are the qualitative. So that is often happen also. Sir, is it clear, sir?
Yes, sir. Sir, one more question.
Yes,
Actually,
please.
is there any limit that how many articles should be considered during this review?
Very good question. Some review also published in the zero article. One article also I found in the systematic review. But usually I say minimum 4-5 studies is there. So when you search a topic tomorrow, we'll be discuss detail about that. So at least you choose at least some studies are conducted in that area. There is no systematic review. Good. Minimum 3-4 study also you can do. Even if some study I found published in one article also. Then you say that evidence gap in that area.
Okay.
But
Sir, I have one
yes,
question.
yes, please.
Hello.
Yes, please.
Yeah. About the research question registration sites such as Prospero, JBI, OSF. So my question is, if we are developing a research question, should we do we have to verify or check whether that research question has been previously done or not in just one site or all the sites for this?
Very good question. Usually we can check Prospero because now you can check also JBI. So that that part will become today only. 15 minutes we'll spend on that. So usually what happens, no, if you not check, someone is doing the work
So,
already done, already they are conducting. You are duplicating that work. Before you publish, they can publish. Then we will be take your studies. It happened with us also sometimes. In
so we
one of
need to verify it in all the registration
not
sites.
all exactly. If you do search a Prospero and currently JBI is very recent, so that fine. JBI and Prospero you can choose, check, then you can go if any ongoing study is going on. That should be done. I think I should encourage every systematic review for, means I think persons those who are conducting systematic review, they must search two database. If anyone is going on, it should not be duplicate.
Okay, okay, sir.
Hmm. So any other
Sir,
questions? Yes,
Excuse
please,
me, sir.
please.
sir, when we can register our systematic review after developing a research question, or when complete whole the review?
No, no, no. So, yes. So, you should develop your protocol. Protocol means your procedure, how to do, what your strategy, what your inclusion criteria, what is your exclusion criteria, what is the population, what is the context domain. So, then once you develop the protocol and base source strategy, then you registered it. Then you will be get the registration number. After completion means you did everything. So, what is that? So, then the Prospero team they will review your methodology. If any challenge also or any error in that methodology, they will be suggested for the editing. So it is ideally suggested that before starting the review, you should register it. Got my
Okay, sir. Thank
got
you.
the answer? Okay. So
Yes,
Excuse
sir.
me, sir.
yes, please.
Yes, sir. So for a systematic review, we can only take if we are taking sir, we will only take only one kind of article, or we can take a different kind of study altogether to do a systematic review.
Kind in the sense design.
Yes, sir. I'm concentrating on design, like study design. I'm concentrating about like cross-sectional studies, or like case report study, or like we can take all together different kind of studies, or we are only considering a particular study to do systematic review.
Honestly, a very good question. It depends on my research question. If my research question is to the point, what is the effectiveness of X drug or X intervention in this community? Then I may not need observational studies or anything. I only focus on the experimental studies. Then I may take only either quasi-experimental or I may take only the clinical trial or experimental studies. It depends. If my research question is that what is the prevalence, etiology, and barrier for the anemia in a specific community. In that case, I may include all type of studies, qualitative, quantitative, every type of studies. Then it is compromise my research question. It should be very specific. If I want to say prevalence of anemia in India, then I have to only focus on the cross-sectional studies. If I want to barrier and challenge for iron folic acid consumptions, then I will be more focused on the qualitative evidence. So you can take, but the what type of study design you will be take that depend on your research question. Got it, Ananya?
Yes, sir. Okay, sir. Thank you, sir.
Thank you. So anyone have any questions? Then we'll be go ahead. Okay, if you have no question, then let us move to these sections. So my my research question is, what is the prevalence of dengue in India? So how will be, so suppose your supervisor or your someone or your if you are working in a institute organization, some government give. So tell me the situation of dengue or what is the prevalence of dengue in India. So where will we get this information? Anyone can answer. There are multiple sources. Please participate in the discussions. I don't know how many are sleeping or not, but because I'm not able to see you. So, so what is the prevalence of dengue in India? So what is the source of informations?
Sir,
Yes, please.
sir, as the this is the notifiable disease, IDSP can be a source,
Very
or
good. IDSP.
yes,
Then,
sir. Real-time evidence, we can evidence-based, we can get the information.
okay. So you will be get from IDSP integrated management system. That means Minister of Health. Okay. So then any other source?
And the number of articles in Google Scholar and PubMed, or maybe in other
Okay. You can say published article. Okay. That good. Any other source?
news also can be one of the
Very good.
source.
Yeah. News could be one of the source also. That
Yes.
could be source. So anyone else, any other idea? So I'm absolutely okay in all this. Yes, first Minister of Health, I can say. I didn't mention it could be in IDSP, it could be other database, it could be center, state, or whatever the database you can say. It could be report also. So that could be or surveillance, disease surveillance, that is IDSP, integrated disease surveillance system. You could have report, you can have bulletin, or you could have annual report of the state or national annual reports. That is good source also. So get it. Another also the international organization like WHO, they publish reports and update on dengue and other vector-borne diseases. They provide data on specific Southeast Asia country specific also. You can get also like malaria. You can get from the WHO bulletin. You can get also. So these two sources are there. So this is very live data. We can say what Mahesh sir has exactly mentioned. So it is routine data, we can use that also. But sometimes taking this data, compiling data, analyzing the data is also difficult because it's more individualized data also you can get also. IDSP previously it is sub-center level. Now you can get individually cases also. So these are the terminology. But another suggestion also get published studies in peer-reviewed journal. Okay, so suppose I found 5 studies in the prevalence of seroprevalence of dengue in India. So one study say 60%. One study says Sudipto sir suppose gave this assignment to you that okay, what is the prevalence of dengue in India? Find the literature and say me the answer. So you found one study in the says okay, prevalence of dengue is 30%. One study says prevalence of dengue is 40%. One study said 10%. One study said 90%. One study said 50%. So these are the number they given. But Sudhita sir say, tell me in one word only. I don't want to this study. So summarize and tell me the finding. So what will be the answer? 130, 40, 50, 90. So like this, you get the number. So what will be your answer? I want only one. So you search systematically search all these. These are the published literature, and okay, these are the number prevalence presented in the study. Then you have to communicate with the policymaker, or you have to communicate the minister. So you cannot say that minister, okay, this study says, this study says, this study says. So overall, so how you will say? What will be the answer? Anyone guess?
Not sure, sir.
Yeah. So this is actually needed a meta-analysis here. So here you see there is a systematic review conducted by Ganesh Kumar et in 2018 on the dengue infection in India. It's a systematic review and meta-analysis. It's published in PLOS Neglected Tropical Disease. What they study, they systematically search all the article related to that. So these are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, around 12 articles they found. And they found that which year also 1989 to 2013 the studies are included. Then they found the overall prevalence in each studies. Okay, even also what is the sample size also, then what is the prevalence. So you see that first study says 25.4, second study says 10.7, another study says 93.0, another study says 62.0, another say 80, another say 58, another 23, 58, 28, 89. So what will be conclude? What will be conclude? Here, you can do a meta-analysis. You can do a forest plot. What the forest plot will be give? It will give a pooled prevalence of the study with the confidence interval. In this case, you can do sensitive analysis also. For example, one study is very low population, high confidence, in very wide confidence interval. Then you can exclude also, that is called sensitive analysis. That will be detailed discussed. Some of the people export in this systematic meta-analysis also they will day. I am just today introduce what is the meta-analysis. So here, if I say the prevalence of dengue in India, as per this systematic review, 56.9%. If I say 56%, 9% full prevalence of dengue, seroprevalence of dengue, that's my answer. So this is the systematic review and meta-analysis. So systematically, we collected all articles, screen article, identify the records, then we extract the data, then we plot a forest plot. So this picture is called the forest plot. So we can do a funnel plot also, how to reduce the bias, or extremist case study also we can include. We can do sensitive analysis. So that will be, we'll learn in 6th or 7th class also more detail about that also. So similarly, let us see that another example so then what is the meta-analysis then? What we discuss now? So meta-analysis is a statistical technique used to combine and analyze data from multiple independent studies on the same topic. Here topic is the seroprevalence of dengue. And the studies are 12 independent studies. So we combined all the studies, collect the information, and put a pooled prevalence. By pooling results, it aims to identify patterns, derive more precise estimate, and improve the reliability of conclusion. This approach is commonly used in the field of medicine, public health, psychology, education, and social science. So it provides a powerful way to synthesize evidence, but its validity depends on the quality of included study and proper methodology. It's also very important. So this is the meta-analysis. So then question is all systematic review need meta-analysis? Definitely the answer is no. If you have a sufficient quantitative information and they have also very homogeneity in the result, then we can go for the meta-analysis. If we found the number, it's one study presented, suppose it's the effective of the let it be that we found one new antibiotic, then I am saying, okay, effectiveness of cotrimoxazole against the UTI, urinary tract infections. This is a clinical question. What is the effectiveness of cotrimoxazole against urinary tract infections? Then there are many randomized control trial study, for example, conducted. Then you found one study presented outcome as a success rate, one study presented outcome as hospital stay, one study said that. So then you don't, even if it is a RCT also, you cannot do any meta-analysis. If all the studies reported same outcome as a means as a success rate or either it is effect cure it is or not, cure or not, then you do that. Okay, when it is provided, what is the that? So if you even you are doing randomized control trial systematic review also, if the information are very heterogeneous, then you cannot do meta-analysis, you can present it. So similarly, if I not get the information very clearly in quantitative way, then I cannot do. Then I can propose only systematic review. So when you do registration, you propose for the meta-analysis, but it is not often possible so if you not get good quality studies. So next is that key features of meta-analysis. It's a quantitative approach, uses statistical method to calculate an overall effect or outcomes, often with a confidence intervals. So some statistical skill is required. Combining result, aggregate data from various studies to increase the sample size and statistical power. It's very objective assessment, reduce individual study bias and provides a clear understanding of the topic. It study variability, That means account for differences, heterogeneity in the study design. So then we can include all the study also. We can do subgroup analysis also. We can do subgroup analysis also. So, so these are the things I think when you discuss about meta-analysis classes, we'll get more example. So this is just introduction of what meta-analysis I do. So where we apply, we provide a pooled prevalence and our diagnostic accuracy. It determines the effectiveness of treatment or intervention. It identifies the risk factor. It also summarizes the evidence for the policy. So these are the application of the meta-analysis findings. So what are the steps? Conduct a meta-analysis. First, yes, it's a systematic review and meta-analysis. So you have a proper research question, you have a search strategy, then you have a quality assessment of the study. Then you extract the data, then you apply statistical analysis and interpret the result. So these are the key steps in conducting meta-analysis. So first, systematic review. Then if you have enough quantitative data, then you can use the software or statistical analysis tool to get that forest plot, pool prevalence, or SORC. So these are the things. So we can discuss another. So this is also say some example how the result of meta-analysis look like. It's the proportions. If you see different study have different proportions with confidence interval, but what is the overall or combined proportion is 0.22. 0.22 with the range confidence interval 0.17 to 0.27. So it is the meta-analysis of prevalence study. For example, if I want to know the diagnostic accuracy, sensitivity, specificity of particular instrument, now how can see? Suppose some technology is there for the let us see that hemoglobin. So there is a new hemoglobin meter in invasive non-invasive hemoglobin meter. I want to find out what is the diagnostic accuracy, how correctly it provide the result with the gold standard. Then I'll do the meta-analysis of sensitivity and specificity like a gold standard. Then there are 5, 6, 7, 8 studies. One say it is 77%, one say 90%, one say 65, 91, like this. Then how can I conclude that? So I will take the pooled sensitivity of that all the studies. You have to do. So here, if you properly extract the data, feed in the Excel sheet, then you put the software. Software will be very nicely draw this diagram for you. So that would be learn in the consequence in the subsequent classes. So this is the another way. Similarly, another thing also, effectiveness of these drugs. So if you say odds ratio is given for the intervention or for control group, then you find out what is that value. Then you can say odds is 0.3746. This. Then what is the pooled value? Pooled value is 0.37. Then you can say either this intervention is favor towards the control group or favor towards the intervention group. If it is favor towards the intervention group, then your drug is effective. If it is favor towards the control group, then your drug is not effective. So then these are the studies. These are all the studies you get it. All randomized control trial study. Similarly, if you get quasi-experimental study, you can do. So this is the meta-analysis, and this is called forest plot. So we'll be detailed discuss what is forest plot, what are the different parts of the plot in the meta-analysis sessions. So I think everyone is clear about that. So we'll be have remaining 10-15 minutes on the protocol registration, but detailed protocol registration will be studies in between. So if any questions or any doubt, we can take 1-2 questions. Okay, let us go for the protocol registration. Okay.
Sir.
Yes, please.
Yeah, sir, is there any time limit for these? I mean, for how much duration should we be including these studies? Let us say 10 years, 15 years.
Sir, it's depend on you. You can do from the beginning onwards. You can do last 10 decades also. So it is depend. You have to define that with a proper region. With a proper region, you have to define. If I want to see last 10, 20 years also is fine. You have to precise or studies within that period. If you say, okay, I'll be starts from the beginning, that also fine. Then you can do sensitive analysis, very old study, you can exclude latter also.
Yes.
Definitely you have to give a time period of a search strategy. But it again depends on your research question, what you want to see.
Right, sir. Sir, one additional question in this. Actually, if as you said that there would be some studies which would say evidence is lesser or no sufficient evidence is present.
What we will do with this study?
Yeah, then shall we increase the time span or something like that?
Yes, you can. You may sort the study. You can exclude the studies from your analysis. You present, okay, these are the studies. However, these are studies with very low quality evidence. After quality checking, you may not include in the meta-analysis. You put it as a descriptive finding. You can often exclude some studies from your meta-analysis, or you can beginning also you can include based on the you cannot not at all include in your review also that studies. It's possible.
Yeah, fine, sir.
Are you follow of me or not? Or I am very fast? Okay, so let us then discuss about the protocol. So developing protocol, it's definitely what I already say that it's require a team. It's require a significant amount of time to complete the studies. Some of them also high expectation that I am doing this course means my systematic review, I can do it and I fulfill my part of the academic. Yeah, but it is need definitely significant amount of time. It require adherence, transparent and rigorous methods. It require a very strong project management team. So when you start the research, I definitely request one of your team members like Avinav or Rakesh I think Melinda, those who are already did systematic review, they can guide you. If subject export needed, we can improve proper subject export, then we can do that. It requires commitment, clear and open communications among all team members. And finally, it requires very much patience. You cannot say that I start the systematic review, then you can learn. You can learn by doing this gradually, you can learn this. Then, so that's why it's a very tedious process, but it is very good to learn whatever the field, whatever the subject, doesn't matter, it's a methods. So tomorrow, if you give someone, okay, do systematic review in psychiatry, as a methodologist, I can help them. If you someone say, okay, it's a cardiac related things, I can do that also. If someone it is related to the urology related things, I can do the as a methodology. But yes, definitely subject expert opinion is very important. Their feedback is very important. But as a methodology, if you learn methodology, definitely it is very useful and it is needed nowadays. Second thing, so these are the steps as per the Prospero protocol. I think tomorrow or day after tomorrow will learn detail. So first stage is the preparation. So means you assembly the team, review the methodology, what are my standard, develop your research questions, determine if there is no review in this area in topic. Then you develop your research protocol, develop and test the search strategy, search and retrieve the relevant citations. This is the preparation. Then come to the screening stage. Pilot screen and screen the title and abstract only. Then retrieve and what database you are, what software you are using for the screening. So that will be help you also. Then full text review, then piloting the screen. Then you do also gray literature search also sometimes like Google Scholar say if any article is missing. Then you do synthesizing. Before synthesizing, you do quality assessment of the study, critical appraisal of the study. Then you synthesize the data, then update the search. Then if necessary, you do meta-analysis. These all processes are called screening and synthesizing called retrieval. Retrieval. Then finally, you write the report. So these. Then now the question is that where will we do our systematic review registration? Why a protocol is needed? Why systematic protocol is needed? There are several reasons. First of all, avoid the duplicate effort. If some study is going on, already someone is going, I should not do that because systematic review is broad search they do. So if recently some study is published, I can do also because they already, it is not a primary studies. You are collecting the data. It is a already published studies. and someone already collect the study and synthesize the evidence provided. So why should you do that? If someone is continuing, why should I do that also? It avoid duplicate. When you register the Prospero or any platform, then it acts, you should have avoid the duplicate effort. Then transparency and accountability is also very important. Like when I will be fill some form. Suppose I'm applying a job, they have a prescribed format. So I have to follow their format. Word limit, what they should name, how the date of birth, every criteria I have to fill. Somewhere also red mark is there. That means it's a mandate field. So when I register my protocol, I will follow the standard, which will be have very accountability and transparency in the methodology. So when you maintain the accountability and transparency, definitely prevent the reporting bias. So if you have a standard reporting bias, that means if you have a follow the transparency accountability, you have a improved methodological quality also. Okay, then it will be prevent the reporting bias. Then it will be very useful for the publication and funding considerations. If that's why many publications they need a prior protocol registration number before you publish the study, main study. And when you do protocol registrations, before you conducted the study, you registered. It takes 15 days to 3 months time period to get that number. Then by the time when we submit it, then you start your search. You start your work. So, but don't think that, okay, I completed my studies, then you that. Then you have to little bit lies also. I'm starting the study, then you registered it. It is not possible also. Okay, so these are the reason why do a protocol registration. So I have an explanation in detail also why do a protocol registrations. Then second is that where I will do registers. Yes, Prosper is there. It's an international prospective register of systematic review that is called Prospero. It's one of the most well-known register for systematic review. Then another is that Open Science Forum, OSF is there. It's a free open access platform for the researcher to share their research outputs and protocols. It is not it is not exclusive to systematic review, but you can also register to your protocol and share your work with the research in the community also. So that you do. Prosper is good one. Then Cochrane library. If the study is related to Cochrane systematic review, then you can do a study in a Cochrane review only. If your systematic review focused on healthcare interventions, and Cochrane is take only intervention studies. So that you have to do in Cochrane only. And if Campbell collaboration, you can do in Campbell also. Then JBI also you can do register now. So the question is that can I need one or two platform to registers? Yes, it is like it is like the journal. So once you submit in one journal, then you cannot do submit for other journal unless it is rejected. So if you already register your study in Cochrane, then you don't need to register in Prospero. If you registered in Prospero, you don't go registered in Open Science Forum and Campbell or JBI. So you choose one platform to register. That's enough. You don't need to register in multiple platforms. One platform is enough. Some people are also do registered in OSF, then they do registered in Prospera also, but it is a crime. It is not good practice. Okay, so these are the platform, and this is the also site of the Prospero. It's a in NIHR Institute, National Institute for Health Care Research. Then so you can create a ID, then you can do, then maybe in one class will be detail discuss about the Prospero protocol, what is needed. So maybe we will do that class also. Dr. Ravina and me will take the sessions also, Prospero registration process one day. So this is all about the today's session. I hope we got the basic exposure. So before we finish, let me say end up with one example and your opinion about that. Then we'll be take some questions and finish the today's class. And thanks many of your busy schedule you attend. But yes, I have two group of people, group 1 and group 2. 10 members, they want to learn swimming. they registered. Suppose SAIHP is trending swimming, and 10 persons they registered for swimming. Please carefully listen this question. I will be individually ask this answer to any one of you. So 10 people registered for SAIHP for the swimming training. So it's a period of 6 months. Then what happened? Five, we divided into two group Melinda group and Abhinav group. Melinda group 5 people and Avinav sir group 5 people. So what Melinda madam trained, how Melinda madam trained them? Melinda madam say, I am internationally exposure. I know many. I did my master in London school. Then what I'll do? I have very strong in literature review. Melinda madam find a very good book. Which book is written by the 5 times Olympic champion in swimming. Melinda Madam give this book to the students and every day teach them theoretically. And all these 5 students remember each and everything, how to do this way, that way, everything they practice and remember the things. 6 months, if you say how to swimming in the under the water, they will say, okay, this is found in this page number and you have to do this. Okay. And Avinav, so they remember all the things, each and everything in the 6 months. Then another group, Avinav say, okay, the Avinav is very, don't have any book or anything. Avinav what started? 5 group people, see, he took into them a small pond where very little water is there. Then 1 hour every day they do exercise. One hour they start swimming themselves, and Avinav watch them and give some instruction. Then after 2 months, Avinav take them for a little more water, means where they up to the water is up to their neck. First he started 3 feet water or 4 feet water. Then he took them to 5 feet water. Then gradually in the 6 months, he took them into the 7 feet water and they started swimming. They learn every day, 1 hour, 2 hour they spend or weekly 20, 30 hours they spend for these activities. So finally, 6 months course completed in the both group. Then I say, okay, now here it's the examination states. Then I took one person from the Melinda Madam group, one person from the Avinav Sir group. Then I took them both. Then I just take them to the Naraj bridge, where the water is up to, under the bridge, water is up to 7 feet. Let it be 7 feet. Then I push both of them, Melinda Madam students and Abhinav sir students. So the question is now, who will be survive? So 7 feet water after the 6 months course with Melinda Madam, after the 6 months course with Abhinav sir, both of them came. Now I test them. I took both of them and just pushed them both into the 7 feet water. Then who will be survive? Who have high chance of survive? Because Melinda Madam students already learned the book written by the 6-time Olympic champion. They remember all the sentence line by line. Which page number? Like Vivekananda, he says which page number, which line number. They tell everything. Okay. So, and Avinav sir students just practice 1 hour every day. So who will survive? So this question to Ananyasri.
Sir, Avinav sir's student, because they are more into practicing every day.
Okay, so your answer is Abhinav sir. Melinda Madam student will not survive, although they remember each and every sentence and they are also
If
learn the book.
if they would have practiced it along with learning all the procedures.
Okay, very good. What is the answer, Nagma? What do you think, Nagma? Dr. Nagma, are you there? Okay.
Hello.
Who will survive?
Hello.
Abhinav sir or Melinda Madam student? Dr. Navga, you are not audible.
So the network is a better.
Okay, okay. We can go to the another one. Melinda, you can ask your favorite students, then they will support your answer. They'll say at least Melinda, madam. So you can randomly pick anyone.
Um, Manojit Saman. I think Dr. Nagma is saying she's
Hello,
saying
hello. Can you hear
Yes,
me?
yes. Manojit, who will
Yeah.
survive?
From my perception, I'll tell Abhinav sir student will be survive because if we don't do the practical, then we can't get nothing. Like
Very good answer.
without practical theories, nothing.
Okay, good,
Yeah.
good, Manojit. So now two people say support Abhinav sir. So anyone who interested to support Melinda madam? Anyone have opinion about Melinda madam, or everybody agree with the Abhinav sir group? Yes, that's my question. So now let us this 2 month or 3 months or remaining period of your life. You want to if you want to join Melinda madam group, just complete this course. We enjoy your 3,000 amount. Then you will be nothing learn, and you will be very good to teach systematic review to others in your academic or academic life or professor life or your teaching life. You will do very good teacher. You will be become, because I will provide very good slides and everything. But you never do a real time work which is needed. If you really want to swimming, learning, same thing also driving also, then you could join the approach by Avinav sir. So that's why if you want to really learn, then you formulate your group, 4 to 5 members group, 3 to 4 members group, start a research question, then you do the work. Then we are here to catch your hands and show you the support. I will not pull you the directly 7 feet water suddenly. We'll be allow you to play in the 3 feet water. Then gradually will be improve, that will take into the deep water. And so will be support you, hand holding support. Then you'll, your life, you will learn this. Otherwise, if you only attend this course, not doing and not engage and not put other effort, then it is very difficult to learn. Because don't take it in negative way. I'm very straightforward persons. So that is very important for learning. If you attend the most top expert in the world who is teaching systematic review, if you attend the course, then it will be not useful unless you apply it, you do it. So with this sentence, we can stop this session today. So if anyone have any doubt or any discussion, we can take 2 3 questions. Then otherwise we can stop. So anyone have any idea? So then I request Melinda, Abhinav, please make a group, allow them some assignment, start them, then at least they could learn. Yes,
Sir.
sir.
Sir,
Mahesh
it
sir.
was an excellent session, sir. Thank you very much for the same.
Thank you, Mahesh sir. So
Yes,
definitely I expect some randomized control trial study from you, because I want to learn from you also, sir. Because
sir.
some you took some very nice topic where we could do any intervention, then you could teach all the group also. Then those who
Yes,
are
sir.
interested will be attached 2 3 student with your group. They can
Yes,
do
sir.
the
Sir, it will
work,
be my
you can
pleasure, sir.
support them also. So
Yes,
it's
sir.
very good if you took some randomized control trial in your area, wherever it is you feel the systematic review is lacking and necessary. Sir, I will be very happy to learn from you also,
Yes, sir. It will
because
be my
it's very
pleasure,
good.
sir. Sure,
Yeah,
sir.
and it will be
Just
easier
one.
for you also. We
Yeah,
can get good quality things also, sir.
exactly, exactly. Sir, just one question. If we are using article which are paid, or I mean, kind of to which
Sir,
permission is needed.
you do that if you have any article. Dr. Pranav and me, we are associated with Harvard. Currently, we have a Harvard student, both in lifetime Harvard student. So we have a Harvard ID. So I will find out the article for you. So if you have 10, 20, 30 article, if it is available, we have access to Harvard library. I can do that, or else I have also
Yes,
means
sir.
that
Thank you very much.
base all database also. Even don't need those who are worried about their database also. We have a very good team, and we have access to database, all
Exactly.
type of database we have access. will be help you to search and do things. Not now, in the lifelong also. If you want to do support and collaborate work, we can happy to do that.
Definitely.
And
Thank you, sir.
thanks, SAIHP,
Thank you.
for this platform, and thanks for involving me. Because although other working days my busy schedule, fix this class for the Saturday. I'm very happy to do that. But I'm the person whom I don't like to only theoretical things. But I'll be more happy if we'll be actively engaged and give some product. So that will be good. Thank you, my sir. So anyone
Thank
have
you. Sir,
any?
one additional question.
Sure, sure,
Sir,
sir.
whether permission from author should be needed to use the article?
No needed, sir. No needed. If they published it, why should I? Author will be more happy if you cite that article. As a
Yeah,
author, I will be
exactly.
very happy if you read my article, cite my article. I will be very happy, sir, because it will be give my
Exactly.
credential. No, my article citation will be increased. My reading will be increased. I every day I check research get also how many read my article, how many cite my article. I get updated mail. Then that's
Exactly.
author permission is not needed because it's publicly
Thank
available.
you. Yeah, thank you, sir. Thank you.
Thank you, sir. So anyone have any question? Ananya, what you learned today? Can you summarize in 1-2 sentence?
Yes, sir. The basics of systematic review and how it is important, and what is evidence-based studies, how they are, how it can be utilized in the systematic reviews, and
Have
what.
you got understanding why when we need meta-analysis? Have you got any idea?
Yeah, so I have one question regarding that. Meta-analysis, does it has to be a part of systematic review, or it can be done independently?
First systematic review, then meta-analysis.
Okay.
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 So always say meta-analysis is attached with systematic review. Without the systematic review, there is not possible of meta-analysis. Okay.
Okay.
So,
Okay.
but sometimes you could have only systematic review. Meta-analysis may not be possible.
Okay, sir.
Okay, when you write anything, any research title, you can say that, or paper title, this is systematic review and meta-analysis. Not only only you cannot find, very rarely you can find only meta-analysis, but I think often there are systematic review and meta-analysis.
So
But
after
all
systematic reviews, there will be meta-analysis.
yes, but often all the studies systematic review not required meta-analysis unless it is planned very beginning, unless you have a homogeneous or some unique quantitative result.
Okay,
If there
sir.
is many heterogeneity, you can do that. Okay.
Okay.
So, okay, Melinda and Avinav want to share anything? Avinav is there? Okay. So,
Yes,
Melinda.
yes, sir, I am here.
Yeah, Avinav, you want to share anything?
No, sir, thank you so much for joining us. And I just want to add one thing to what you said about Mahesh sir's question regarding if some article is not openly accessible, then what should be done. So, one thing is that obviously they can always reach to us and we'll be supporting them. But in real life scenarios, if that is not the option, then in that case, you can always contact the corresponding author of the paper. So
Right.
if because most of the times corresponding author's email is mentioned, so if corresponding author agrees to give the full text, then that is good. If they do not agree, then something else could be done.
That will teach you afterwards.
Yes. Yes.
Everybody know this, Avinav. क्या साइपी ना क्या है SCI ना
हाँ सर
Yes,
वो
yes,
तो
I have done all.
SAIHP. So, but we'll be get it article. I hope. But some of those things, I got when even I saw in the Harvard site also, it was not a full paper. It was an abstract or conference paper. So that we excluded very quickly also. So that in that case, you should not worry about that handle. So Avinav, anything you want to add?
no sir, thank you sir.
I think no, you can group all the means dental students in one group, such as they can learn, they can team together. You can formulate the team where they can work together And I'm happy that you can attach two or three them with Sudipta sir. Then they can learn. Sudipta sir may not be screening, but sir could guide, and you can attach two three them with Mahesh sir also. Those are interested in RCT related studies, and you can put detail the dental students. They can work together. They can really learn. Okay, so in this way, you can formulate the group where you could at least we could get good benefit of this. Before the other classes, you can formulate it, you can decide it, then we can engage them in effectively in a real world systematic review.
Sure, sir. Yes.
So Melinda, you want to add something?
No, I think we can circulate a form amongst the participants, knowing what backgrounds they come from, and then we can easily group. That's what I was thinking.
Yes. So that's good. So your interest is also very important, no? Which area you are in, want
Yes.
to interest.
Yes,
Okay.
that's something we can do. And also that we'll be sharing. Thank you, sir, for delivering the session today. It was very interesting, and I think this is just the first session, and there are many more and interesting ones to come. Thank you for all the participants for joining us. We'll be shortly also sharing our social media handles and profiles with you in on the WhatsApp group. So if you haven't joined the WhatsApp group so far, please check your emails. In the last but one email, the invitation link is given. Please join for more updates. And please follow us also on social media because we'll be giving on what's coming in the next sessions or workshops that will be coming, or even webinars, which most of them are free. You can join us and stay tuned further.
So
Thank you again.
Melinda, I'll share my slide PDF from of slide to you. Then you can share with them. Okay.
Yes, with all the participants
Now
via
now
email.
I'll share you only today only. Now only I'll share.
For sure.
Okay. Thank you everyone. Thank you.
Thank you
Thank you,
so much.
sir.
Thank you.